So we're very excited. Today we have Dr. Coupet, who's going to be speaking to us about healthcare issues that small business owners should know about, should think about, and should plan for. Now, before we get started with the event, I just want to make sure that everyone knows with the Chamber, we are based in Florida. We do service all of the state of Florida. And Breakfast with the Chamber event is one of the ways that we try to give value to membership when it comes to being an active member of the Chamber. If anyone is interested in getting more involved, we definitely encourage you to go online, send us an email, reach out to us. You're welcome to reach out to me. My name is Patricia Elise, and I am the chair of the Breakfast with the Chamber board. And just a few announcements. The Chamber is very involved with the census. So we encourage everyone, if they haven't already filled out their census, to make sure to get that in as soon as possible. And we have an event coming up, also a plan for success, getting your business back on, and that's going to be on July 1st. If you haven't received those emails, we encourage you to log on, sign up for emails, follow up on Facebook so that you can register. Now, I'm going to introduce our main speaker for today, which is Dr. Sidney Coupet, who's going to be speaking to us. Dr. Coupet is the founder of Spark Health, an organization that supports clinics to deliver comprehensive community healthcare services using innovative membership model called direct primary care. The model is comprehensive and consists of primary and preventative care, chronic disease management, behavioral health services, and wellness. Dr. Coupet is the Chief Medical Officer of Coupet Quality Clinic, a flagship center for Spark Health that is located in Fort Lauderdale, Florida, where he provides healthcare services to hundreds of ethnically diverse patients. Dr. Coupet also serves as a primary care advisor for Santé Nou, a U.S. healthcare logistics company that provides healthcare for people traveling to Haiti, while simultaneously delivering primary and preventative care for those residing in Haiti. Dr. Coupet has received a number of awards and distinctions throughout his career. For example, in 2005, he was awarded with the Albert Schweitzer Fellowship. He was awarded in 2008 as being the Black Achievers Award in Medicine, and has been featured in South Florida Hospital News. Dr. Coupet obtained his medical degree at Lake Erie College of Osteopathic Medicine and received a master's in public health in health policy management at the University of Pittsburgh. He completed his residency training in internal medicine at J. Singer Medical Center. Dr. Coupet went on to do his fellowship at University of Michigan and received a master's in health services. So we're very lucky to have him as our main speaker today. Dr. Coupet, please take it over.
Thank you so much, Patricia. And that was pretty impressive in terms of the pronunciation. And thank you for such warm welcome. Hello, members of the Chamber, and it's an honor to be here with you all this morning. And I really look forward to being more engaged with the Haitian American Chamber of Commerce, especially during critical times like these. I wish we've got more engaged even sooner, but unfortunately, things happen, but I think this is an appropriate time, if any, for us to really come together. And I appreciate the work that you all are doing. This is a very important platform for small businesses and mid-sized businesses to really get information concerning and things that can impact their business. Clearly, health is on everybody's mind. And hence, I guess I was invited to really talk about some healthcare issues. Again, a lot of the things I'm going to present today is probably not new in terms of the difficulties of small businesses. I'm assuming this is going to be majority of your members in the Chamber of Commerce, okay? So, a lot of the issues small businesses historically have been dealing with. And so in the setting of COVID-19, it's going to be very important that we address these things head on. Just some disclosures. I'm actually the founder of Spark Health Incorporated, as you heard from this wonderful introduction that Patricia did for me. And I'm also the Chief Medical Officer for Coupet Quality Clinic, again, which is a direct primary care clinic. And I'll get into that much later. So my intentions this morning, and I hope everybody got their coffee. I have mine, as you can tell. So, I want to talk to you all about just a conversation concerning the value of small businesses. And it'll be brief because you probably know this better than I, as a consortium of a lot of small businesses. So it's clear the value that you bring to our communities and the importance of your survival. In addition, I'm going to talk about the importance of accessing healthcare as a small business owner and for your employees, right? And then clearly the barriers to accessing this healthcare. And again, this has been an issue even as long as 2008, and with the hope that the Affordable Care Act was supposed to create some more access to small businesses, but I'll get into that in a bit. In addition, I will be talking about accessing healthcare in the face of COVID-19. And lastly, some things I think small businesses should know, especially in times like these. So I hope everybody's okay with this intentions for this morning. Again, I'll be available at the end for questions. And so let's begin. So we all know the value of small businesses. You all may or may not know this, but small businesses really employ close to 50% of all the private workforce in the United States. So if you could imagine that, this is very important. That's a lot of jobs for people in communities. And if you look at the past 10 years, the total net gains of jobs is much larger with small businesses than it is for larger employers. And so again, another value that small businesses add to our community. And not to mention the rich culture that small businesses provide to communities, allow people to recruit talents. We always talk about that our communities tend to lose some of our brightest and most talented individuals. And so the ability to have small businesses in our communities really will allow us to retain those talents. And ultimately even drive tourism and allow people to come in and spend money in our communities. And so I think small businesses is where it is and is where it's at. And we should support our small businesses if we really care about our communities, especially the economic value for our communities. Now, one of the things, when we think about accessing healthcare for small businesses, it's a value proposition I hope I don't have to make here and convince too much, but we know the importance of health benefits. It obviously helps with hiring and recruiting, and employees will be more loyal to you because, we know that health benefits is hard to obtain, especially in this type of environment. When you have healthy employees, they're more productive staff, they're satisfied. It does foster a healthy culture. It implies that you value health. And I think we all should consider this, not just only in the setting of COVID-19, but even long-term, because our communities suffer a lot of health disparities. And so when you have a company that values health, it really attracts a lot of great, talented individuals. Not to mention, there's some tax benefits for employees depending on how you obtain health benefits. And lastly, health coverage within reach of employees obviously is very important because when we think about costs, it becomes a factor. And so, but I guess, in a nutshell, being able to offer employees health benefits really prevents absenteeism, prevent presenteeism, especially in this setting of viral transmission, because you don't want anyone coming to work sick. So I can go on and on about the value of having healthcare for your employees as a small business owner. And so I know historically, due to some of the barriers of accessing healthcare, we negotiate our health. In other words, we state to ourselves that maybe we could get away without having health insurance for our employees. Maybe our employees could take that on their own. And we don't even have accountability for that. So some things that I believe that can cause small businesses to fall into that trap of basically saying, laissez-faire, we give it to the employees to deal with, or if they close their eyes, they can just ignore the issue. But unfortunately, we can't do that any longer. And with COVID-19, you see that we are responsible for each other. And as a small business owner, what you do and what you decide impacts us all. So I think the first step is educating ourselves as small business owners. The nomenclature of healthcare is very complex, but just some basic things. Health insurance is not healthcare, right? We need to really separate the two. You can have all the health insurance you want, but you don't get healthcare. And so it is two different things. So really get familiar with what is the healthcare delivery, aspects of things, and what's health insurance. What are the payers? So making that differentiation in your mind is going to be very important and moving forward. Now, also understanding premiums and deductibles, what those things are. And again, excuse me if a lot of this is familiar to all of you already, but I think it's important to reinforce because a lot of our small businesses, believe it or not, are not aware of these terminologies. Premiums is that monthly payment you make to that health plan or that insurance. In addition, there's something called deductibles. Deductibles is the expectation of that insurance of what you're supposed to pay out throughout the year before they decide to cover a percentage of the healthcare services that you'll be getting. So again, just get familiar with the nomenclatures. A lot of the times, people who owns little restaurants or even garages, mechanics, they're not familiar with these terms. And so it's going to be very important for them to understand that in order to start the dialogue. Also, obviously, we have to understand this healthcare benefits business. What are fully funded plans? We got to understand what that is. These are your Blue Cross Blue Shields, these Aetnas that offer, from primary care to specialty services at a premium price. And that can be pretty hefty. And that could actually scare a lot of small businesses away because they're pretty expensive. I mean, you're looking at anywhere from $800 a month for individuals to as much as $1,200 for families and even higher. So these fully funded plans are usually popular among larger companies. Understand what a high deductible plan is. These are plans where the premiums are very, very low, but your deductibles is high. So as opposed to a fully funded plan where you would pay for an individual $800 a month, your deductible may be $200 or $300. That's how much you got to pay out of your pocket before the insurance cover. But in a high deductible plan, that deductible could be as high as $5,000, $6,000. And I'll get into that later on in this conversation. Understand what health savings accounts are, HSAs accounts, how they can be used innovatively to pay for health services. Understand what an individual mandate is. Clearly with the new administration now, that mandate was removed. And so now individuals are not mandated to carry health insurance, which further increases the barrier for small businesses to do the right thing. Not to mention employer mandate. A lot of small businesses are confused about that a little bit when I speak to them in the community. It's really those who have the employer mandate are 50 employees or more. And anyone who has less than that are not obliged to follow this employer mandate. But again, healthcare should be something that we all get involved in. And so all employers should be concerned about this. But at least this employer mandate, which by the way, is still applicable even in this current administration, that if you have 50 or more employees, there must be some evidence that you are actually paying for health benefits for your employees, or you actually are involved in sharing the costs for health benefits for employees. Now, one thing I want to red flag here is the association of health plans and tax incentives. This is where a lot of small businesses are able to negotiate a lower premium for their employees, especially if you are an employer with less than 50 employees, you know, pay attention to the Association of Health Plans. Basically, it's almost like a marketplace where all small businesses come together and they're able to have a negotiation power for the premiums they pay. Not to mention, you get health benefits as an employer for employees. There's tax incentives, there's tax credits, there's tax incentives at the end of the year. So keep those things in mind. Again, familiarize yourself and understand this healthcare benefits, healthcare insurance business. Because again, without your knowledge of these things, and if you are ignorant to them, you will miss out. And more importantly, you'll put yourself and your employer's health at risk. So please, please, I encourage all of you to, you know, educate yourself on these healthcare benefits. Increasing costs of health insurance, you know, it's going to rise. In 2021, it's expected to go up. And especially with the cost of this pandemic, there's going to be a skyrocket of these premiums, which is going to make it even more, you know, harder for small businesses to get coverage for themselves. And it's going to be outreach, it's going to be out of their reach. And this is what's scary. And I don't know how to best explain this, but, you know, communities in America, we're in trouble. You know, we are going to have communities who are basically going to be unhealthy, who's not going to have access to basic healthcare services unless we do something about it. So lastly, the economic impact of COVID-19, you know, businesses losing money, et cetera. So these are all barriers, as you can imagine. I'm sure everyone sitting here can think of other barriers in terms of accessing healthcare as a small business owner. Now, some suggestions. We purchase health insurance through groups, and I mentioned this earlier in the previous slides. Right now, even as you know, the Haitian American Chamber of Commerce of Florida can look at bringing all of the small businesses that they have as members together and looking at health insurance plans, because they will offer you guys a better range of premium, a better pricing if more people come together and purchase the insurance. So not sure if you guys are already doing this, but chambers of commerce are doing this, and this is the group format of purchasing. So these are some suggestions that small businesses could certainly do that they can't do on their own. So if we can encourage all chambers in our communities to really look at bringing small businesses together, because we all value. If our small businesses succeed, we also succeed. And again, education is one aspect, but we have to think outside the box. As I mentioned earlier, there is a difference between healthcare and health insurance. If you don't have health insurance, does not mean you're unable to get healthcare services. There's different types of innovations that are out there. Now, in the settings of health insurance, outside the box would be getting a high deductible plan for your employers. So that means an insurance that's probably the most affordable and that has a high deductible, $6,000, $7,000. Granted, the employee will pay everything out of their pocket with every visit to the doctor, with every health issues, but at least it gives them something. Because if they land in the hospital, whatever reason, their healthcare cost, hospitalization cost itself can cost someone over $40,000 to $50,000. And so if somebody has a deductible at $6,000, $7,000, it's not a bad deal, right? So after that hospitalization, they just pay $7,000 when, the hospitalization could run them close to $50,000 to $60,000. So, health, high deductible plans, it's not ideal, but it is something. And especially if you can pair it up with like health savings accounts, that's like the ideal situation, because then either yourself or your employees can contribute, or both can contribute to a health savings account, which is tax-free. And so it's always attractive for employees and employers to look at getting a high deductible plan that's affordable for them, as well as partnering up with a health savings account, and where they can use that money for basic care. There is something called skinny healthcare plans that are solely for non-catastrophic health events. So basically, it doesn't cover hospitalization, doesn't cover surgery, doesn't cover specialty care. All it does, it covers your primary care, preventative care, chronic disease management, routine medical care, and wellness benefits, the things that keep people out of the hospital. I personally think those skinny plans are great. In fact, some argue that they rather get a skinny plan than a high deductible plan. Number one, the skinny plans are more affordable than the high deductible plans. And number two, the philosophy is in the right place, right? You want to prevent people from getting sick. You want to keep them healthy. And skinny plans does that, especially if you have the right primary care doctor and the providers to go along with it. So really it's about thinking through this healthcare and this complex healthcare system. And there's no question it's complicated. But if we're able to educate ourselves and each other and really support one another, we can get through this. Now, there is an innovative model that's out there. And full disclosure, this innovative model is called direct primary care. And the full disclosure is that we were one of the first, Coupet Quality Clinic was one of the first in Broward County to bring this model to the Broward County area. Direct primary care offers a direct membership. So that means it's like joining a gym membership, and you can have access to all the services that that particular clinic or physician offers. These memberships can run anywhere from $30 to $70 a month. And so employers love these models because what they do is they purchase them in group. And some direct primary care clinics, they would offer a flat rate, like $50 for everybody. So if you can imagine, you have 10 employees, you pay $50 for them, and they have basic primary care, chronic disease management. Like for instance, in my office, we also offer behavioral health services. Everything is at cost. So that means if they were to buy medications, for instance, medications that would cost you $40, $50 in the pharmacy, they're paying $1.25 for it, or 50 cents for that same medication. And so same thing with x-rays as well. Direct primary care offers a lot of cost benefits, especially when you're dealing with healthcare services. So x-rays are like $30 when you know that x-rays can cost you anywhere from $200 to $300. So there's a lot of cost benefits. Direct primary care are physicians and nurse practitioners who decide that they're going to cut out the middleman and deal directly with patients. And it is awesome. It's an awesome program. It's a great way to get basic care. It's a great way to get access immediately. So I would encourage all small businesses to look at the direct primary care practices in your communities. They're popping up all around the country. And so we encourage you to do that. The only thing I would caution you with direct primary care services is that you should also look for a high deductible plan or some sort of insurance on the side in case you get hospitalized. At that way, it's a match made in heaven. A lot of cost savings for people. Direct primary care offices offer a quality service, so they want to take care of people. So it's almost like getting concierge level of care in that office. You get direct access to your providers where you can text, call, FaceTime your providers right in the comfort of your home. I mean, I can't say enough about direct primary care. I mean, it's an exciting program. And these are the type of innovations that communities are coming up with to address this gap around accessing healthcare, especially for small businesses and everyone else in our community. So again, we have to think, we gotta think our way through this complex system, but it doesn't have to be complicated. It all starts with relationships, and this is one of the reasons why I'm here. And so these are some suggestions. And now, I know a lot of us already have heard everything we need to know about COVID-19. And, one of the things Patricia mentioned in my introduction, I think one of the most important thing is what I do on a day-to-day basis. I have to tell you, I'm a practitioner, I'm a pragmatic person. I can care less about degrees or positions. It's what have I done? And I'll tell you, so far, I've taken care of 198 COVID-19 positive patients. I have taken care of 78 of them as an outpatient. and the rest are inpatient setting. I've taken care of COVID patients that were asymptomatic. I've taken care of COVID patients that have mild to moderate symptoms or illnesses. And I've also taken care of COVID patients that have severe illness, where not only they're in the hospital, but some of them are in critical condition on the ventilator. So in the past 3-4 years, 3-4 months, has been very challenging for me and for a lot of us. And to be able to, deal in this world of uncertainties with this virus. Although we knew a lot about coronavirus, just like you, as information was coming out, we were trying to adjust our interventions. I like to say this is the first time our society witnessed the race between saving lives and providing evidence-based medicine to people. And that's the challenge. This is what we're dealing with. And so you see all the noises with politicians and et cetera, but us here in the industry and providers, physicians, we're really focused. We understand what's going on here. Coronavirus, this is probably, we have maybe about 7 strands of coronavirus now. The most popular ones you all heard of was SARS, MERS. You all have heard of those two because they were more recent in our generation. But again, coronavirus is not new. COVID-19 is a particular strand. The scientific term for COVID-19 is SARS-CoV-2. So it's CoV-2. That's the virus. That's the scientific name for it. But we call it COVID-19. It is a particular strand. It is a coronavirus, nonetheless. It functions similar to all coronavirus. But this strand, for some reason, is highly transmissible. And this is why it quickly went from an epidemic to a pandemic. Now, we also know that this virus not only causes severe morbidity, it also causes severe mortality, specifically in our community. I hope we all understand the reason why this is happening to our Black and Brown communities is because we've been dealing with something more severe for decades, which is something called healthcare disparities. And because of that, this COVID-19 is impacting our communities and getting us sicker, and we are dying more. And so it is so important that we as small businesses in our Black and Brown communities understand how to handle this. And so right now, there's no treatment available for COVID-19. I'm gonna repeat this. No available treatment for COVID-19. We have a lot of experimental drugs going on right now in the hospitals. Currently, we're dealing with remdesivir. We're looking at convalescent plasma. That's basically people who were already affected with the COVID-19, and we take their plasma, inject it in people who are currently sick, okay? That is to help us fight the disease. And to be frank, that's the most promising treatment so far in all the studies that are going on, as well as remdesivir, which is an antiviral drug. So just want to give you guys some background information on that. So, but at this moment in time, we have not approved a particular treatment. Now, clearly, we're waiting for a vaccination. When that comes out, it's going to be very important. As small business owners, we encourage that, especially when we're trying to get our employees back to work. But there's a vaccination trial going on now, and so we're watching that closely as well. But the strongest weapon we've had thus far is the social distancing, is what we've been doing. And now that the communities are opening back up, how do we practice social distancing? Well, we have to do it nonetheless, right? 6 feet apart from each other, and if we can't practice social distancing, we have to wear face masks. As you heard more recently, face masks now are being mandatory for Miami-Dade County as well as Broward now. And wearing a face mask is going to be mandatory. And I think this is going to be what we call the new norm. Hand washing, hand sanitizers have to be readily available in your businesses. There's no question about that, because that is the way we avoid transmitting this disease. And that's the best evidence we have in terms of fighting this pandemic. Now, small businesses need to understand testing as well around, first of all, there's 2 types of testing. There's the antigen testing and the antibody testing. So it's important when your employees come to work, they said, oh, I got tested, always find out which test they got. Is it the antigen test? And if this is an antigen test, the antigen test just simply tells you if you are currently infected with the virus, okay, if you have the virus. The incubation period for the virus from the time you contact it and to the time it starts developing and you can transmit it is the first 7 days. And it can go as long as the first 14 days where you can potentially transmit the virus. So if I test you and you're infected with coronavirus, I can get a positive antigen test for as up to 30 days. So if you're infected with this virus, I can actually check to see if it's positive, then you're positive. Whether you are in the first 7 days or whether you're at the 28 days, it depends on the clinical presentation, right? But again, that's the antigen test. The antibody test, well, this is a little bit more sophisticated because number one, what we check is the antibodies against the coronavirus. If that's positive, what that tells me is that not only have you had the virus, but you recovered from the virus. And not only that you recovered from the virus, we are presuming that you are now immune to the virus. Okay, so you develop an immune response, and so therefore you cannot get the virus again. Again, let's educate ourselves about these testing because as you can imagine, when you're thinking about how to navigate your employees through your businesses, where the exposures are, as an employer, this is going to be very important to you. And you need to understand testing, and you need to use testing in order for you to figure out how to get your business running again. Again, I think testing, I think face masks, social distancing is going to be the new norms. To be frank, maybe it's something we should have been doing anyway because there's other diseases out there that we need to be careful about. So I hope this small overview of what we need to know about COVID-19 is helpful. I just basically thought about the things that businesses are concerned about. I'm not trying to make all you guys scientists or doctors, but at the end of the day, these are the things that you need to spend more time with and understanding. I want to thank you all just for listening. I am looking forward to hearing questions and having a conversation with you this morning. I didn't want to take too much time with the presentation, so I am open for questions.
That was great. That was a lot of information. Thank you so much. I'm sure that a lot of people have questions about COVID-19. I definitely learned a lot about the virus that I didn't know before. I didn't realize that we had so many different kinds of strands of COVID-19. I know that one of the questions that I have is there are different ways of us protecting ourselves for different products, right? So right now, because COVID-19 is the big thing, there are a lot of different masks being put on the market. There's a lot of different hand sanitizers, a lot of different kind of sprays. How can we go about making sure that whatever we're purchasing is actually going to be helping us and not just a useless tool that we're buying on the market?
Great question, Patricia. One of the things, hand washing with soap is the ideal, is the gold standard. I mean, you can't beat that. How long do you wash your hands for? I mean, there's different conversations about that, but you want to wash it for at least 20 seconds, at minimum, just to be safe. And it's not just washing that long, it's covering all the surface of your hands. So hand washing is indeed the gold standard. So I assume all small businesses at least have available sinks and bathroom for frequent hand washing, especially let's say if you're a restaurant, et cetera, that's going to be very important for you. Now, if you have to, and you don't have access to maybe hand washing abilities or it's not readily available, then you can look at alcohol-based hand sanitizers. And the easiest way to look at it is, as you heard, I mean, you can look up the CDC. It all has to be 60% at minimum of alcohol-based. So whatever hand sanitizers you like, there's some that smell good, have said some don't. But the most important thing is that they have enough alcohol content, at least 60%, for it to be effective. And again, it's covering the whole surface of your hands. And I hope that was helpful.
That was great. I'm not sure if anyone else has some questions. Let's see. So we have one question that if anyone has a question, they're welcome to put it in the chat or even unmute themselves so that they can ask it directly. But I see a question here from Rose Capia, which she says, can high deductible plan be combined with a skinny plan, which I like for its preventative role?
So that's great, and I believe yes, and that's the right question, the answer. But the thing is that that's not common. Partly it's because it can get costly. High deductible plans themselves, although it's much more affordable, when you're thinking about people who opt for those, they're paying about $150 to $200 for those plans. And then when you add a skinny plan to that, which could be $80, $90, and you know, it's basically you have two health insurance. Again, it doesn't guarantee health care. So this is why sometimes the skinny plans go along on their own based off of a good network. You know, you have to look at the network of providers that these skinny plans offer. But the only difference, the high deductible plans, they will cover any healthcare services from any provider. And ideally, they are combined either with a HSA or with a direct primary care office. Because then at that point, your employees and your employers even have the ability to select their physicians that they prefer and have a direct relationship. So it's not common that you combine a high deductible plan and a skinny plan, because you're basically having two payers, and who knows what they cover. But again, you know, you can do that though.
Okay, great. How about for small business owners that are now opening up their offices? So I'm currently physically in my office. I'm in my law firm. I've tried to take as many precautions as possible to make sure that myself and my employees are safe. But what are the most important things we can do now for us that are going back to work to make sure that we are protecting ourselves from the virus?
You know, and you know, it's one of the things that we mentioned earlier is really using all the public health measures that was suggested first and foremost. You know, you got to keep yourself safe. But in addition to that, you may have to assure that you have access to some sort of healthcare services. You know, this is the time that we have to act now in making sure that we have that. I can't let, for instance, you, Patricia, to negotiate your healthcare on your own, right? To decide, well, you know, I don't need the hospital right now. Or, you know, this is definitely not my heart. This is not my lungs. This is something else. This is where we get into trouble, right? Or, you know, I can't sit back and allow you to say, you know, all I need to do is, you know, pues otite asoci or something like that and make my life, you know, great again. So you definitely need some sort of a professional to guide you through this. So access is going to be so paramount, especially during a pandemic, because if people who are sick and let's say they call in because they have fevers, and let me back up for a second. And as a small business owner who is opening up, you need to make sure you set clear policies for your employees that if they're feeling symptoms, they think they're having a cough, to stay home. That is something you can certainly do in addition to the safety protocols, where you're creating frequent cleaning in your office, hand washing, et cetera. I mean, in my office, we clean 3 times. First thing when we open up, during lunch break, and then at the end of the day. So stuff like this you can implement in your office. And then also, you can also look at creating policies for employees about if they get sick, what do? Call in, don't come in. You know, if you suspect somebody in the office sick, speak up, tell them, tell your boss, you know, because we can't have that type of negligence around us because it can cost somebody's life. So those policies are going to be very important as you open up. And then lastly is this access. You have to have some sort of access, because if they're home, let's say in quarantine because they don't know what they have, or in isolation, who's monitoring for the right symptoms? Because there's some symptoms that might prompt someone that, you know, to go to the hospital, like shortness of breath. But again, it gets complicated because if somebody has already lung disease, what is their baseline? You know, so you don't want unnecessary visits to the hospitals neither, because the hospitals obviously are overburdened with a lot of cases. So again, it's so important to not negotiate these things on your own. And so, so having access to a provider is going to be important.
So I see we have a follow-up question from Mr. Philippe Alma. How can we spread the preventative measures in our community and reduce the risk in the Haitian American community? How can we involve our prime communicators? Basically, how can we educate our Haitian community? Both, I would love to hear both here in the US and also in Haiti as to preventative measures for COVID-19.
Now, you know, there's a lot of people, a lot of experts out there who are doing an amazing job already as it is. So I don't even think I'm qualified to know how to really state, you know, the best way to market this thing. But I can tell you it's all about, you know, community outreach, right? It's all about what you're seeing right now on television and, you know, flyers and posters, et cetera. You know, for me, as a small business owner myself, right, you know, a primary care office, you know, we educate every single person that comes to our office. I educate every person at the end of every telemedicine visit. I make sure that I ask, do you have any questions about the coronavirus? Any concerns about the coronavirus? We put information on our website about the coronavirus and how to protect yourselves. You know, we knew that we have a lot of support, you know, in the community. So we went on social media and we were talking about that. And one of the things that I do on social media, if you follow me, and I'm gonna put a shameless plug here, you know, at Dr. Sidney Coupet is my handle at Instagram. So I do fun things there. You know, as a direct primary care doctor, our patients love to know their doctor on a personal level. So my page is public, and through that, I educate about, you know, the coronavirus, but I educate in a unique way. It's like, what am I doing about it, right? Because, you know, even though I am looked upon as a leader, I share my stories. So the narrative is so important. It will definitely influence people in the right direction. So I encourage everyone to share their stories, share their experiences as well, because that's a powerful way of influencing people and doing the right thing. Unfortunately, a lot of us have tragic experiences, right, with this pandemic. Mm-hmm. You know, and sharing those stories are going to be very important. You know, where people who passed away during this pandemic and having a funeral, which is limited, right, where you can't even pay your last respects. You know, things like that really wake people up and open people's eyes to really doing the right thing. So I think certainly sharing our stories, whether if it's using technology, social media, even having a cup of coffee in this nice breakfast session we're having here, this is all we need to do. And we need to keep doing that.
And we have a great follow-up question concerning healthcare plans here. How about those who are undocumented? Are there different options for them? And especially for agricultural workers?
Yeah. You know, so this is why I wanted to bring the chambers and their members' attention to direct primary care, because undocumented individuals really don't have much choices out in the community. In fact, I'll tell you, you know, before I went into becoming a direct primary care provider, 4 years ago, I was the chief of hospital medicine at a local hospital. And through that role, for the years that I spent as the chief of hospital medicine, I witnessed a lot of illness. I witnessed a lot of people dying, even coming to the hospital unnecessarily. And then when I delved deeper, I recognized that a lot of them don't have access. And a majority of them were undocumented. And they've been living in our communities for years. In fact, some of them have been living there longer than I was born, right? So I don't want to tell you my age, but still, I think though that we can appreciate that our communities are diverse. And so our uninsured, undocumented people who don't have some sort of status, immigrants who can't get any access at all, they need to look at innovative models like direct primary care, because that offers people a direct membership. It's like I said, it's joining a membership. It doesn't care about your status. It doesn't care about pre-existing conditions. In fact, most direct primary care offices only base the rate on your age. And so I'm sure, you know, a mother who came from Haiti, who don't have access, but has high blood pressure, have diabetes. And if that's not controlled, they will end up in the hospital or something even worse. And so accessing and looking for direct primary care practices in your communities are going to be paramount, especially for people who are undocumented, because then at least they'll have some basic care. They'll get their medications, they'll get managed, et cetera. So those are some of the suggestions I have.
Okay, great. And in the intro, I did mention in your bio that you are also very involved with Santé Nou in Haiti. Would you like to give maybe a little background story or clarification or maybe update as to what's happening with that project?
Absolutely, absolutely. Something new is exciting. I mean, it's an exciting time for us. It's an exciting time for Haitians. It's exciting times for Haiti. What is Something New? Something New is a U.S. healthcare logistic company that offers us the opportunity when we're traveling to Haiti to have emergency services catered to us. If something were to happen to us, it can logistically organize providers to basically save our lives. So if we were injured anywhere in Haiti at any point in time, Something New has coordinated delivery services that includes a provider coming to your aid immediately. That includes even a transport agent, ambulance, or a helicopter taking you to a healthcare facility in Haiti that can provide you quality emergency healthcare services. And if necessary, depending on the illness or the situation, will life flight you out of the country to a nearby healthcare delivery system that could certainly save your life. And if necessary, even bring you back to the United States to do that. And so Something New offers us in the diaspora an emergency service. Again, this is not insurance. It actually gives you the service of saving your life if need be. But the most remarkable part about Something New is that in addition to that, you likely have a family member in Haiti. And Something New allows you to enroll that person to be able to have basic primary care, chronic disease management. And that's the most remarkable aspect of Something New, because as you are really reassured and we're going to avec tête frette, you feel as if you feel like you're safe in case you travel, you are able to give primary care and chronic disease ongoing care to your loved ones or someone you care about in Haiti. And so that's Something New in a nutshell. And as you can imagine, the service like this is going to be very important, especially in critical times like the COVID-19 pandemic, because a lot of us are worried about our loved ones in Haiti. Even though we're not traveling, we are concerned about them. And so as I've been speaking about access, that's the number one cause of health disparities. And we know that. That's the number one issue in our country, our beloved country, Haiti. And so this to me is an opportunity. This to me is a possibility that was created for us, by us. This is an amazing possibility for us to say that we can now improve the healthcare of our people in Haiti, protect them, because we know they deserve that. And at the same time, have the luxury of understanding that if we go to Haiti, we are covered. And so that is Something New. And as the primary care advisor, as you can imagine, I really drive quality, making sure that it's not just simply access that we provide to people in Haiti. We provide them a direct primary care experience, a concierge-like experience, a customer experience that's no other. I mean, you hear people in Haiti who are receiving this care from Something New. They're like, wow, not only have I never seen a primary care doctor, but they treat me like a human being. And so one of the things that attracted me to this organization, Something New, is the humanity that they bring back to healthcare, especially in a country like Haiti. And so I'm very excited about Something New. And if anyone have not heard about what Something New is doing, I encourage you to go to their website, go to their social media, Something New Haiti. I mean, these guys are doing some amazing work, and they have my 110% support.
Great. So if anyone is interested in getting in contact with you, how can they go about doing that?
I'm glad you asked that. And this here is my next slide. And so, everyone who's listening, first of all, I want to thank you all for the time, because I know you all are busy and doing amazing work in the community. And I applaud you all for that. And just taking the time this morning to spend some time with me here. My whole thing is to get related with folks. We cannot accomplish anything in our community without relatedness. We have to be related to each other. I mean, at this time, politics aside, personal agendas aside, I mean, we just have to come together and work together. I have joined the Haitian American Coalition of South Florida, where it's a response to the COVID-19 pandemic. Amazing group of healthcare professionals, professionals of all disciplines, by the way, that's being led by Dr. Geda Nicola. And I am part of the healthcare task force, in which I'm leading that as well. And there's amazing people. The point of this task force is all about relatedness, figuring out where are our resources in the community, where are they, and bring them together. Because there's a lot of us in the community who are struggling right now, and they need a hand. And we're better off with numbers. I mean, we shouldn't just have a flag that says "Union fait la force." I mean, we should live that, right? So essentially, I am behind the Haitian American Coalition of South Florida. And again, if you have not heard about the Haitian American Coalition of South Florida, you really should. Again, it's a group of Haitian professionals, organizations of all types that came together to protect our community here in South Florida. And so we all are related, and we are accomplishing a lot. Due to the collaboration, we were able to establish test sites. The Holy Christ in North Miami test site was an effort by the coalition, along with support from our representative, specifically Representative Dottie Joseph. We thank her for the support, but we were able to actually pull this off. And so these are the type of things that the coalition is doing. We're getting a list of all the clinics in our communities that are serving Haitian people, because we know that this pandemic is going to affect them more. And so we need to know what resources that they need, whether if it's PPEs, whether if it's telemedicine abilities. So the coalition is doing a lot of work. So I just wanted to put a plug in for the coalition and for everyone to at least support this type of initiative, especially during these critical times. But again, for me, again, direct primary care is essential. This is my office number. This is our website. If you have any questions about whether your small businesses, about how to access healthcare, I'm not a health insurance broker. I'm not an agent, but I am able to give you some guidance around, what makes sense. Because at the end of the day, healthcare is about what? Healthcare is about the nucleus. It's that nucleus. That nucleus is patient and doctor relationship. That's the nucleus of healthcare. So the nucleus of healthcare is the doctor and patient. It's a provider and patient. And so anything that tries to destroy that is not worth talking about. And so the reason I'm bringing that up is because I think we have to start thinking of it that way. Reach out to the healthcare providers in your community, because you might realize that you might have more access than you think. And so this is my contact. And I hope, I get some contacts. You can send me, follow me on IG. That's another shameless plug. I love Instagram. I try my best to stay as active as possible. Yes. So thank you, Patricia.
Thank you. That was great. Thank you so much for that great presentation. Again, everyone, this was our June Breakfast with the Chamber event. Thank you so much for joining us. We are hosting these virtual breakfast events the last Friday of every month. Our next event with the Chamber will be on July 1st. It's going to be a lunch event, a plan for success, getting your business back on track. The link for you to register is already on our social media. I invite everyone to follow us on Facebook at the Haitian American Chamber of Commerce of Florida page, along with Instagram. If you're not already a member, please make sure to either email us, call us. You can call my office, or you can go online and find the information online, the phone number, so that you can get more information as to how to get to be more involved with the Chamber, to be an active member of the Chamber, so that you can possibly be one of our future speakers, or you can speak to us about how we can help you grow and manage your business. Again, just a few announcements. please, if you have not already signed up and completed the census, it's extremely important for our community, and we strongly, strongly encourage you to go ahead and do that. And we are hosting some we're working on a lot of different panels and a lot of different events coming up for the year. If you guys have any issues that you want us to really focus on, please do not be shy. Please go ahead and reach out to us. You can reach out to me personally, or you can reach out to the chamber through our website. Our goal is to really provide our members the information that they need so that they can get to the next level, their businesses can get to the next level, so that we can all grow together. So unless anyone has any other questions, I want to thank everyone again for coming out and logging in this morning. Thank you again, Dr. Coupet, for an amazing job. We really appreciate it. We're giving you a virtual round of applause. And I hope that, sure. And I hope everyone has a great day.
You guys too, and be safe. Thank you again for this opportunity.
Oh, you're very welcome. Thank you, everyone. Take care.